All right, team. We've got a patient with condensing osteitis, paramyositis, and enterocolitis. What do you think is the diagnosis here?
It could be a number of things. Maybe it's an autoimmune disorder affecting multiple systems.
I'm leaning towards some sort of systemic infection causing these symptoms.
I think we should consider a rare genetic disease that presents with these manifestations.
What if it's a combination of environmental factors triggering an inflammatory response in the body?
Enough.
But Hawks, that procedure is extremely risky. Are you sure that's the right call?
I don't give a damn about the risk. It's our only shot at saving this patient. Now, move. We don't have time to waste. Tracy, I need to talk to you about my patient with encephalitis. I believe we should go ahead with decompressive craniectomy.
Hawks, I understand your expertise and experience, but we need to consider all options carefully. You have a tendency to jump into risky procedures.
Are you questioning my years of experience and knowledge in neurosurgery? I know what's best for my patient.
Hawks, I'm just concerned because your track record shows that sometimes your initial diagnosis and treatment plan have been incorrect. We need to be cautious.
I can't believe you're second guessing me like this. I know what I'm doing, and I won't let my patient suffer because of your doubts.
Hawks, I'm not trying to undermine you. I just want to make sure we're making the best decision for the patient. Let's discuss this further before making any final decisions.
Leslie, the patient is in critical condition. I just reviewed the case and it's clear now that the decompressive craniectomy was not the right treatment for encephalitis.
That's not good. What are we gonna do now?
I need to tell Hawks about this. He needs to be informed that the initial treatment was a mistake.
Frank, I understand the importance of informing Hawks, but shouldn't our focus be on saving the patient right now? Their health is the priority.
You're right, Leslie. Let's stabilize the patient first. We can deal with the consequences of informing Hawks later. Our priority is to do everything we can to help this patient.
What the hell were you thinking? You almost killed the patient with your incompetence.
We followed the protocol, Hawks. We did our best with the information we had.
Maybe there was a complication we didn't foresee. It's not entirely our fault.
I still think it was the right call, Hawks. We can't predict every outcome.
I agree with Frank. We can't be blamed for every risk that comes with surgery.
You call this a risk? This was plain stupidity. I should have never trusted you idiots with this procedure. I'll deal with the mess you've made now. Just stay out of my sight. Unbelievable. Can't rely on anyone around here. So, Johnson, how's everything going outside the hospital? Any exciting plans coming up?
Actually, things have been going pretty well. I've been spending more time with my family lately and catching up on some hobbies. It's been nice to take a break from the long shifts at work.
That's good to hear. Family time is important. By the way, have you heard about the case of that patient in room 305? It's been baffling me for days.
Oh yeah, I heard about that case. It does seem pretty complex. Have you made any progress in figuring out what's wrong?
I think I might have just cracked it. It all makes sense now. I need to go check on something right away.
Wait, already? But we just sat down to eat. What about finishing lunch together?
I'm sorry, Johnson. This is urgent. I'll catch up with you later. Thanks for the chat. Sorry I'm late, but we need to act fast. Forget the gear, we have a critical case on our hands.
Hawks, you can't just barge in here without proper protection. You're putting yourself and the patient at risk.
He's right, Hawks. We have protocols for a reason, you know.
Listen, encephalitis was a misinterpretation. It's actually Sjogren. Larsen syndrome.
Sjogren? Larsen syndrome? What's the prognosis for that, Hawks?
The prognosis for Sjogren. Larsen syndrome is generally good, but it primarily affects the skin and the nervous system.
So what's the treatment plan then? How do we move forward with this new diagnosis?
We need to start with symptomatic treatment and long-term management. Let's get to work. Time is of the essence here. Tracy, I finally found the right diagnosis for the patient.
That's great news, Hawks. Well done on solving the case.
If only I didn't have such idiotic doctors to work with, the wrong diagnosis wouldn't have been made in the first place.
What do you mean by that? You gave the wrong diagnosis yourself, Hawks.
Well, my diagnostics team should have caught that error before it escalated.
Hawks, you can't blame others for your mistakes.
I don't have time for this. I'll be in my office.